Hello, I'm Dr.Deepak Devakar, dermatologist and hair transplant surgeon practicing at Dermasculpt Skin and Hair Clinic, Jayanagar, Bangalore. Excessive hair fall remedies. What is excessive hair fall? If the hair's shedding is beyond your normal shedding of hair every day, then it is excessive. But it can be 10% more or it can be 100% more than your natural hair fall. If you are seeing 10 to 20 hair shedding per day and you suddenly see 50 hair shedding, it is not normal. But if your hair is shedding 50 every day and it continues to be 50, it is not termed as an excessive shedding of hair. But in some cases, the shedding can be more than 100 hairs, which is suddenly they start shedding too much. So how to take care of this? Causes of excessive hair fall can be many, like nutritional causes, any health conditions which is affecting you, any medications you are on, or any recent illness, hormonal changes in the body, or any such stressful activities or any surgeries we have underwent. All these can cause excessive shedding of hair. Children or adults, anybody can get shedding of hair excessively. So how to take care of this? First of all, you need to have a healthy diet. Balanced, healthy, nutritious food, proteins, vegetables, fruits, all this is required in a balanced quantity. There is no specific single food that will be helpful for your hair. It is a balanced diet. The balanced diet is what is the important point. You need to have all different types of foods in a balanced diet. So this will help in reducing the shedding of hair. Second, you need to consult a doctor so that we can examine your scalp. What is the reason for such sudden shedding of hair? Scalp conditions can be there, hair follicle or hair root damages can be there, or there may be some skin diseases which might be affecting the scalp. Some are called as scarring, which is a permanent loss of the hair, and some are temporary shedding of hair. So this can be examined by doing a computerized analysis at our clinic. So we'll be able to have a magnified image and understand the hair follicle at the deepest layer and how it is going to change and how we can give a best treatment for you to reduce the shedding of hair. Naturally, if a hair is shedding, you can see there is entire length of hair is falling or it can be breaking. Breaking of hair can be because of various conditions like conditioning, dry frizzy hairs, the wrong shampoos if it is used, or many are using soaps on the scalp to wash their hair. This can make it dry and frizzy. Using a good conditioning shampoo would be helpful. Mild shampoo, sulfate free would be better. Followed by that, you need a conditioner every time which will reduce this breaking. If the full length of hair is falling, then we'll have to examine the scalp. We may have to get some blood tests done, hormonal tests to understand your health and treat this. Usually if there is a temporary shedding of hair, excessive sudden shedding of hair, most of the times it can be reversed and you can grow back the hair normally. But if it is damaging the roots or if there is any kind of such scarring or permanent damage to the hair follicle happening, we need to do a scalp biopsy to understand what sort of disease is happening under the skin. Based on that, we treat the scalp and stop the shedding of it. This shedding can be for a couple of months. Usually once you start seeing shedding of hair, if you start treatment, even in that cases you may not see shedding will reduce in 1 or 2 weeks. It may take 1 to 2 months, but with the right treatment, most of the hairs will grow back and it will avoid permanent damage to the hair follicle.